and we are not taking away the parental rights to be able to make a decision. We want to be sure people have an informed decision. An amendment to clarify that point. There is the Department of Public Health doesn't review the exemption and has to approve it or review it. Right? It's simply the physician writes a note to the school saying that there is what's the reason, duration, which could be indefinite, could be forever if that's an ongoing condition, and they sign it, and the child now has a medical exemption. It is very straightforward, very simple. And it's really again the physician exercising their professional judgment about if the immunization could cause a harm.
Physicians and registered nurses at the department can accept exemptions based on either the CDC or American Academy of Pediatrics guidelines or other reasons consistent with the standard of care.
And then finally, we have an amendment regarding the medical exemption in a physician's judgment. And I've heard from a number of constituents and Californians regarding concerns that a medical exemption is difficult to obtain or was difficult to obtain. I believe that current law states that a physician has complete professional discretion over the writing of a medical exemption. However, I have asked the author to take an amendment to clarify that a medical exemption is entirely within the professional judgment of a physician. And we have agreement on that amendment?
Yes.
Okay, thank you.
So if the first child has a reaction, would there be a medical exemption for the second child?
So the medical exemption...
Does it clearly allow that?
So what the bill and the law clearly states is that the medical exemption is at the professional judgment of the physician. We took an amendment to absolutely clarify that point. And so what that means is that if the physician feels that a sibling of a child, because the condition may be genetic, it may be family related, that therefore that child is also at increased risk, even though that child has not yet suffered harm, then they can exercise their professional judgment to provide an exemption. It's the professional judgment of the physician in terms of what they believe that if the risk of the immunization is going to be such that it's going to put that child at certain or near, basically at increased harm, then they can provide that exemption. And so that's to the judgment of of actually any licensed physician in the state of California. There's no requirement that you even have to go to a physician that you've seen multiple times in the past. The law clearly states that any licensed physician in the state of California can provide a medical exemption. Mainly, what they have to do is document the reason. They document the duration, and there's no limitation. That could be indefinite, and they have to sign it, of course, saying that they're as a licensed physician. Then you get a medical exemption.
If someone says that. I had a child who died of SIDS, and now I don't want to vaccinate my next child. I think there is a question there because there has not been shown to be an association between SIDS and vaccines.
My concern with the current bill that's been put forward by Dr. Pan is that it basically now kicks the decision of the medical exemption to the California Department of Public Health, taking it away from the doctor. But my core concern is that the promise behind 277 was that we were going to preserve the right of the doctor to give out the exemption. And I just think that goes beyond what I committed to people on with regards to my involvement with SB277. So I'm not supportive of the bill. To the extent that this takes away the right of the exemption from the doctor and gives it to the Department of Public Health, I've made too many commitments about the important role of the doctor in this process to feel comfortable supporting the bill. So that's where I am on that.
I was very proud to be a co-author on your first bill. I very much value what that did. I think it addressed a lot of issues. When I asked LAUSD to produce the numbers, it's at a 1 to at least 2, if not higher than 2% increase in every segment of the 6 subsections of LAUSD. 277 worked. It increased everywhere. It increased the outcomes of immunization everywhere. And when I'm looking at what we're trying to accomplish now, because we've spent about 5.5 hours maybe now, or 5 hours? It's 4 o'clock, we started at...
Who's counting?
Oh, who is? I'm trying to just figure out exactly what it is we're trying to accomplish. And I appreciate the conversation we had last week as well. Some of the questions I had didn't get resolved. My goal was if you're gonna move forward with this, and I would have joined you as a co-author again, why not look at the physicians that are specifically conducting in a way that we want to hold accountable? If there are physicians that we are aware of who are offering these exemptions without even seeing their patient, why aren't we addressing that directly? Instead of creating this process that we haven't really talked about how much it's even going to cost the state. And I bring this up because most of my colleagues here, especially those of us who have been serving here now in our fourth term, we've been working in health-related issues. We'll constantly work on areas that we're trying to improve health outcomes, and only to have Department of Health, Public Health, come in maybe 6, 7, 8 months into the bill's life after we've done a lot of work and say there's a big cost associated with this. And turning the bill, and then the author has to turn the bill into a 2-year bill, work through the various amendments, work through the various issues until we get it to a place that we can move forward again. But yet, in this case, when we talk about percentages, so in 2016, we were at about 0.17%, 937 students in 2015-16 school year. And it's gone up to 0.7%, around 4,100 students in 17-18. We're talking about 4,100 students roughly. Out of a population of 40 million in the state, we're talking about a tenth of a hundredth of a percentage point. So that's why I was also asking when Ms. Burke, right around now, that red wine sounds very good, by the way. When Ms. Burke was asking about the numbers again, I wanted to clarify because 179 cases in 3 years. I feel like it's incumbent on us to want to do a study and ask the Department of Public Health to figure out what are the reasons why we don't have, what are the non-vaccination numbers attributable to, so that we come up with best practices so that we can better address what the needs are.
I think the challenge here is we're trying to legislate practice of medicine, and even with the best intentions, that often doesn't, people get caught up in that. I have concerns about legislating a physician's license would be in jeopardy for working with the parents. In the bill, it says doing this is unprofessional conduct, which means you're threatening the license of a physician. It's not clear. I mean, some of it you can say medical necessity, but some of it also, I think, raises some challenges for physicians to know, at what point their license might be threatened.